Hi, my name is T9, and the first MNT that I'm going to show you is an ERSL left of the T2. So here for an ERSL left, I want to bring my patient into an FRS right. So how I can find this kind of restriction is by having my patient sitting in a neutral position, and I'll be palpating the TPs of the T2 vertebrae, and I'll find that the left TP is more posterior and the right TP will be more interior, creating that left rotation in that neutral position. And then I'll ask my patient to gently flex her head forward, and I'll find that the left rotation will stay, meaning that the left facet in this kind of restriction is the problem, because the left facet is not able to open, so it will stay in that closed position. And then I'll ask the patient to go into an extension of the head, and then I'll see that the left rotation will be corrected. So this is how I can find an ERS left for the T2. So as I said, I want to bring my patient into an FRS right. So I'm going to palpate here the SP of the T2, and then I'm going to wrap around my arm against her forehead, and I want to gently flex her head, and I want also to add an AP glide just so that I can bring that SP of T2 more prominent below my fingers. And once I feel that SP more prominent, this is where I know that this is my first barrier for flexion. And then the second barrier would be right side bending. So here I'm going to put my thumb right beside the SP of T2, and I'm going to push it towards the left to create that right side bending, and I'm going to bring her head into slight right side bending. And the last barrier is right rotation. So again, I feel my fingers until that SP is moving, and I bring her head into a right rotation. Here I'll ask my patient to push against my hand here into extension gently for 6 seconds. I can also ask her to push against side bending or rotation, so I can choose the one that she feels the most relief, and then relax after 6 seconds. And then I can repeat those steps, so bring her into more flexion and slight AP glide, and then bring her into more right side bending and right rotation here, and I can repeat those steps 3 to 5 times or until there's no more range to be gained. So this is the first one. The second MET that I'm going to show you is an NSRr right of T9-T12. So here my goal would be to bring my patient into right side bending and a left rotation. So how I can find this restriction, so I'm gonna have my patient prone on the table, and I'm gonna be palpating the TPs from T9 to T12, and I'm gonna see that the right TPs will be more posterior, creating that right rotation. And also when I'm gonna ask my patient to go into a Sphinx pose, so extension, and also child pose, so flexion, I'm gonna see that the rotation will be corrected in both of these positions. So for this MET, I'm gonna have my patient sitting in that straddle position since it increases the stability. So I'm gonna ask my patient to just cross her arms on her chest like that, and I'm gonna wrap my arms around her, and I'm gonna find the T10. So I can either choose T10 or T11 for this MET, because I want to be in the middle of that curve. So here for this one, I'm going to choose T10. So as I said, I want to bring my patient into right side bending and left rotation. So I'm going to push that SP to the left to increase that right side bending, and I'm going to gently rotate her until I feel that SP moving to the left. So I'm going to ask my patient to contract against me into left side bending. I can also ask her to contract to right rotation, but here I'm choosing left side bending. So for 6 seconds, contract here. So once that 6 seconds is done, I can move into another barrier. So push again on that SP to increase that right side bending and left rotation. So you can repeat those steps 3 to 5 times or until there's no more range to be gained.